Good afternoon. This is the response to COVID-19 program on TTT and TTT Live online on Facebook. I'm Vidia Ramphal. The UN Secretary General Antonio Guterres said this week that the COVID-19 pandemic is causing untold fear and suffering for older people across the world. He said the pandemic is putting older people at greater risk of poverty, discrimination, and isolation. The COVID-19 pandemic has clearly had a devastating impact on older people in developing countries, and some experts believe that it will worsen. I spoke to the Honorary Secretary of the Trinidad and Tobago Association of Retired Persons, Mayling Younglao, about the issue. On the occasion of World Elder Abuse Awareness Day, I first asked Ms. Younglao how bad is the problem in Trinidad and Tobago. Thank you so much for chatting with us today. Today is the World Day Against Elderly Abuse. How bad is the problem here in Trinidad and Tobago?
Very bad. Well, first, TTARP is an organization that we look after the senior citizens of Trinidad and Tobago, and we have been doing that for the past 26 years. However, with the pandemic and everybody shut in and staying in, even relatives cannot go and visit their relatives who are institutionalized, and that has caused some mental problems. They act up a little bit, they're demanding, that they see somebody, and they don't understand, because if you tell them today, they forget it tomorrow, So that is some of the stories that we are getting. In addition to that, what I find is a little strange is that for a country where we know how to handle stress. Of course, we line, we cook, we go to the beach, we have carnival. Yet, we find that the elderly abuse is getting more and more prevalent in this country. And we could only put that down to stress. Stress for the younger people, looking after the family, looking after jobs, so we are not sure what is causing this. But TTARP has worked with the relevant authorities on any issues dealing with senior citizens, and we stand willing and able at any time to assist with any authority that need our assistance.
You've said a lot there, but just to take one or two aspects out of what you've said, in terms of COVID-19, so you believe that COVID-19 will make this problem worse?
Yes, but we could take COVID-19 for a plus also, and I wouldn't say make it, it has, because they've been shut in for the past. I myself have some relatives who are in a home, and they were used to seeing us 3-4 times a week, and each time they will act up, and the caregivers will call, and you have to talk to them, and then they understand. But after a day or two, they go back. But we could take this pandemic, coronavirus, as a plus, and use that to get a new norm of how we see the elderly. I think a lot of us see the elderly and we put them aside. We see them because they're old, they don't have no teeth, they're not too cute, they can't remember, they cannot move. But look at you here, you are a journalist and you're a photographer. Where would you have been without an elderly? Where would you have been? Because somebody would have started this journalist story, this how to even make a camera. Everything that we do, the doctor, the lawyer, the mayor, the whoever, is because of an elderly. So why are we seeing the elderlies as a minus? We need to remember our elderlies and give them the dignity and the honor of yesteryear. We are too interested in our lives now that we are rushing around, and we are not getting back to seeing the pluses of our elderly. Yes, we understand that everybody rushing around, and it might be safer for the elderly to be in a home where somebody is looking after them. But even so, we need to make sure we investigate the home, we see the standards that they have, we visit them regularly, we talk to them, and we keep them in the know. When you look at me, an old person, I'm wrinkled, I'm old, I don't have teeth. But what you're not seeing, I'm a young bride, I'm a lover, I'm a dancer, I'm a comedian. I might not look so to you, but inside my memories is still of yesteryear, particularly if they have Alzheimer's, because today memory they won't remember, yesterday they remember. So sometimes when they're acting up, it's because they're being not recognized.
And that reset button, as you've described there, it starts with attitudinal change?
Yes, definitely. Definitely. Right now, all over the world, everybody's talking about Black Lives Matters. And I am saying, see us. See us. The age lives matter. See us. You know, instead of just bypassing us and seeing our physical look, see us.
Very, very powerful words indeed. During this pandemic, how would you have rated what government has done in terms of looking at the problem, or what society has, how they've reacted in terms of dealing with the elderly during
I
this
think
period?
I'm very, very proud of Trinidadians, and particularly our government, the Ministry of Health, and the CMO and the minister. I am really very proud. I'm from a big family, and I have families all over, and they will call me panicking, and I'm telling them, hello, this little dot is doing plenty better than you all. This little dot is doing a lot better. So much so, one of my sisters who have lived away for close to 60 years, you could get my birth certificate, I am coming back home, you know. So they have done extraordinary well. It is really fabulous.
And about elderly abuse, from what you have seen from your position here, what are some of the ways that it shows up? I mean, you referenced a few in your early statement, but what are some of the ways it shows up?
Mainly when we get from members coming in and talking about it as financial abuse. They take away their homes, they take away their deeds, they make them sign it over, they don't even know when that is happening. For those who get in the government pension, that is the only time you will find young people are going in with these elderly to help them cash the check, and then they take their part, put them in a taxi, and send them back home. So, I mean, things like that. There are those who get slapped or just left with the feces or the urine, or don't get them bathed. All that is an abuse, you know. So you don't give them the things that they need. So there are different forms of abuse, and we need to look at all of it. And as I said, with TTARP, once the relevant authorities are willing to put the policies in place and to work with it, we are there willing always to be part of it.
Is there any warning signs that you could let the public know what they can see if they see it in their own families, the neighborhood, or anything like that?
With the abuse? No, generally I think the age keep it in. They keep it in. They would not say it because they are ashamed. As I told you, remember, you are seeing an aged person, but this person is still a principal of a school. They was a manager, you know, an accountant. So they feel ashamed. They know where they have been. They know what they stand for. And to come out and let somebody know and slap them, you know, that they were slapped or they were neglected, no, they will suffer in silence. And I think that is what is taking a lot of the mental problem on the elderly.
This system has worked well during the COVID-19, but what would you like to see going forward to improve conditions for the elderly and they get the dignity and respect that you've talked about?
What I would like to see going forward are the inspectors. First, all these homes that are propping up, that they make sure they're properly inspected and registered, and the inspectors go out and visit them from time to time, look at the meals, look at the accommodation, look at the ventilation. These things are important. I would like to see more people coming out. Just don't put your family or your relative in a home and leave them. Come and see them. If it's once a week, just come and see them, make them feel valued, you know, talk to them, dress them up, you know, bring them back. As I said, they may not remember what is happening today, but they will remember what is happening yesterday, yesteryear, and see me. I'm not this old gray-headed person watching you. See me.
Very powerful statements you've made. Thank you so much. It's been inspiring talking to you today.
Thank you. Thank you very much.
Thank you.
Mayling Younglao of the Trinidad and Tobago Association of Retired Persons, speaking to us there. Now, World Elder Abuse Awareness Day is commemorated each year to highlight one of the worst manifestations of ageism and inequality in our society, elder abuse. The advocate and activist Anton La Fond is another who joined us to talk about the issue of the abuse of the elderly. Advocate and activist Anton, thanks so much for chatting with us today. Could you give us an idea of what you see as the extent of elderly abuse here in Trinidad and Tobago?
First of all, I must say thanks for having me. And I think it is a very salient point to develop on this day. Now, somehow I get a bit of trouble by analyzing why we must have an abuse day, because abuse is nothing that is pleasant. So, you know, having abuse normally gives me a bit of nervousness. However, it is a day, it is an international day, and we have to accept it. But abuse is a general term. People tend to connect abuse with violence, people fighting, and people disorganized because of indifferences. But interview is a broad, the abuse is a broad term, very, very broad term. And we have to be prepared to accept that. And in Trinidad and Tobago, we are not different to any other place in the world. We have abuse as a serious factor, and we must consider it. So your question is that I think that we have to do some serious work about the level of abuse that is taking place.
And as you pointed out, it manifests in so many different ways. What are some of the forms that you've seen in terms of elderly abuse?
Well, barring the natural physical aspect of abuse, abuse stems into so many different categories, because we have psychological abuse, we have mental abuse, I'm not a psychiatrist or a psychologist, so please don't misunderstand me. I am saying that from an average thinking person, you could see how abuse is being done. There are so many examples that we could use, because at times we tend to believe that this is not happening, and it don't connect to you. But families have to be very, very stringent with abuse. For example, you know, we tend to take simple things as for granted. Neglect. A simple thing like that. And you know, elderly persons tend to need a little more connection and concern. And if you just neglect somebody who is elderly, that is an indirect form of abuse. Now, patience is the issue here, because a lot of us don't have patience. We have to develop that. And we have to accept it as a real aspect, because with God's permission, and we live long enough, all of us would be old. All of us would be elders. And we have to prepare for that eventuality. So you have abuse in a simple way. Transportation, because that's why I'm strong. You see people, elderly people using transportation, and when they use it, they have to be very, very, very careful, because people tend to disregard the importance of elders, you know, and they abuse them, you know, they don't treat them with the respect, and respect is on a tangent with abuse. We have to, it's important. So I just give you two examples, and you could go on and on and on. I was pleased with the Massey's introduction to the hour before the actual opening of the groceries. And, you know, when I interviewed elderly people, they said that it is a bit rough on them to get there, and then have to wait and go through the procedure. Now, the balance of life don't always mesh all the time. But I was suggesting that if you have cashiers available, that if they're in the compound and they're going to they're doing their, because they're moving slower than everybody else, and they're going to do their grocery, there's no problem with them going to a cashier and saying, well, this is what I have. Even if you have it separate from, but you have one available or two, based on the demand. So if you not, that in itself shows where they were thinking as far as abuse is concerned, because to have them entwined with everybody else would have been a bit difficult.
Yes, certainly. And as you pointed out, well, during this COVID-19 pandemic,
yes.
things may have actually gotten worse. Do you expect to see more cases, or have you heard of more cases of elderly abuse during this period?
Definitely. But what I will be happy to impart is that the police should have statistics on the level of abuse based on reports. And if they could divulge to the public what sort of levels of abuse occurred during this pandemic time, it would be useful, because we can't fool ourselves. It's happening, and it's painful to really sit and chat with somebody who is being abused and can't do anything about it, especially elders that are homebound, elders that are in wheelchairs, elders that are bedridden. It is heartrending to find that people just don't really take that into consideration. The circle of life is a very funny place, and it goes around. And I'm hoping that those who are performing those ill acts remember that their turn could be coming.
Is there any way to spot that you would tell our viewers, any way to spot elderly abuse?
You see, life is structured on a level of hypocrisy. You could have abuse and it is masked and you don't know. Now, very rare you find somebody letting you see their levels of abuse to an elder. But as they depart from where you are, they come on hard. And you are unable to say, well, but I just talked to that person and they acted normal. But you see, you have to catch them when they least expect. And I think that what we have to do as a country is try to overemphasize the importance of abuse and its negativity. It doesn't go anywhere when you are abusing a situation. No, there are the homes that we have all over the place now, and the homes, I am not saying that they are not doing a reasonably good job, but they can monitor in totality the level of abuse, but they could curtail it. And I think that is very important at this time for us to understand that the abuse, you have nothing to gain. You have nothing absolutely to gain. But you see, human beings act and react in different ways. And if I am not a priest, I am not a social worker, I am just as guilty as a lot of people, but I try to do the correct thing. Yeah. And abuse is not the correct thing.
You pointed out the nursing homes, which is where most people have come to see for themselves on social media the extent of the abuse. We've seen quite a few of these. Is government doing enough to really regulate what's going on at these nursing homes to prevent these things from happening?
Well, what took place with COVID-19, nobody with a reasonable thinking mind could say that the government didn't do a good job. And I am in support of that. Prior to that, it must have been there, and the ups and downs are there. Let me give you a simple example of an abuse in a home. Somebody dropped their sibling to a home and will drop the payment of the persons who are at the home. At Christmas time, they will drop a gift. And that is it. That is a crucial way of abusing, because you're not going to visit that person and chat with them and see how they're progressing. All you're doing is that you have fulfilled your duty. I put them in a home, I'm paying for them, and that is good enough. There's no compunction at all. You don't think about it at all. And that is one of my big problems. You can't just have a human being, your mother, your father, your brother, whoever it is, put them in a home and just leave them and believe you have done a good job. Time will tell.
No system is perfect, but what can we do further as well as we come to the end here? What can we do further to help the elderly get the dignity and respect that they should have?
Simple. Change our attitude toward them. Simple. We just change our attitude and we will be in good stead.
And that attitude, what is it now? What is the Trinidad and Tobago attitude towards the elderly?
It depends on the individual. People vary in their attitude. Now, I am saying I'm thinking positively. As an optimist, I am thinking positively. And I don't think I should delve into the negativity. So I'm living in hope, and I hope that people will come to the realization that these are people too, and they should be recognized for what they did, because the elders are the people who have us here today. They prepared the way, and I think that they should be recognized. So if you change your attitudes towards the elders, you will see a tremendous improvement.
Mr. La Fond, it's been fascinating talking to you. Thank you so much for joining us today.
Thank you very much for having me.
Well, thanks very much to our guest, Anton La Fond, the advocate and activist, and our earlier guest, Mayling Younglao, for joining us for today's program. Before we go, here are some signs of elderly abuse. They include cuts and bruises, malnourishment, poor hygiene, anxiety, and reclusiveness. So please be looking out for those. Now, for continued coverage, remember you can join us on TTT Talk City 91.1 FM, Suite 100, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thanks for joining us. I'm Vidia Ramphal. Bye for now.